let's get started. Thank you today, Steve, for being here, and I'll turn it over to you.
Perfect. Thank you, Sheila. Welcome, everybody. This is going to be an information-packed hour. I've got some resources I'm going to share. Having your phone handy would be helpful. There will be a QR code or two that we'll have available with things that you will want to take advantage of. So as Sheila mentioned, today's webinar is being sponsored by Pearl AI. I am, just by way of disclosure, the founder of the Total Patient Service Institute. We're a coaching education company that focuses on one word, and that word is yes. How to hear yes more often from your patients at every point of interaction. Today, we're going to focus on yes to the appointment and yes to showing up. Our community that we've created over the years of practices that subscribe to our practice management philosophy is the Crown Council, all over the country, with practices that we supply on a daily basis with information like we're going to talk about today. So that gives you a little bit of context. If this helps, I'm not a dentist. I consider that to be an asset in what we do because I'm a consumer researcher and have been my entire life. I look at things from the consumer standpoint, what works based on how the consumer thinks. And we're going to talk about, in terms of scheduling and cancellations and consistency, what works in the consumer mindset today that can add more predictability and consistency to your practice. This is a resource for today. You're welcome to scan this QR code. This is going to be your Stop Cancellations hack sheet. This will highlight the key things that you'll want to implement in your practice. So if you're like most, you're watching today, probably flying solo, I will promise you that one of the takeaways from what we'll share is you will want to share this with your team. This is a whole team approach. It's just not for the front office. So for those of you that are working in the front office, there's going to be application for every member of the team, including the dentist. So scan this. This will help you take it back to the team and help implement the things that we'll talk about today. So with that, I'm going to give you a quick exercise. You're welcome to enter this in the chat box. What word best describes your feeling when it comes to dealing with cancellations and no-shows? So you're welcome to enter that in the chat box. Typically, I hear words like frustration, anger, exhaustion. Thank you, Bridget. Yeah, it's a challenge. And I think everybody would agree that even more of a challenge today than it used to be in the past. There's probably been more than one day in your experience when you walked in and the schedule ended up looking like this, a train wreck because of all the changes. You do your best to create a productive schedule and then life happens. So we're going to talk about really two areas that you can use both prevention and first aid, of what you can do to prevent cancellations and then what you can do in the heat of the moment to try and save an appointment. So who's at risk today? New patients because they're anonymous. You've never had any interaction with them face to face. They're at high risk. Hygiene patients because many times the attitude is, it's just a cleaning, right? What's the big deal? Third area is financial flu patients. So these are the patients that wake up the morning of treatment and they're sick. What they're really sick of is thinking of having to make that payment that's due on the day of treatment. And so they're sick. We'll talk about how to deal with that. And then basically every patient on your schedule today is at risk. So let's first talk about prevention. What can you do to prevent cancellations in the first place? There will be things here that you've heard before. There may be some new things. What I would challenge you to think of is if you hear something you've heard before, to say to what degree are we implementing this? Are we carrying it out in the practice, right? So knowing is not doing, doing is doing, right? So we want to make sure that we're actually implementing the things that we already know that we're supposed to do. This is a team effort, as mentioned. So in the next few minutes, you're going to see how every member of the team participates in this effort. The doctors, the dental assistants, the hygienists, the front office team, everyone has a role to play. So here's the basic rule that patients will place as much importance on their appointment as you do, or conversely, they are unlikely to place more importance on their appointment time as you do. So urgency and importance is one of the key things. So I'm not going to ask for feedback on this. I just want you to consider this. If you had to choose one of the following answers, one of the best cancellation prevention techniques for new patients, let's talk about new patients first. What would you do? Charge a fee for canceling, double book, doctor welcome call, or text, email, and call repeatedly. So let me talk about these real quick. I get asked a lot, should we charge a fee for canceling? The research shows, again, I'm very research based. The research shows that charging a fee for canceling may actually have the opposite effect that you think it does. So for example, if I'm scheduled for a cleaning and that cleaning is going to run me, $200, whatever it might be, or a restorative appointment where the fee for that restorative appointment could be $1,000, $2,500, whatever it might be, and you have a cancellation fee of $50, I think I'll pay the $50. It's cheaper. So again, the research says charging a fee for canceling may have the opposite effect that you think it will. Double booking, not a real good strategy unless you're working in some Medicaid type environments. That's a whole other webinar. So let's talk about C. D, I'm going to take off the list unless you want to be like my pest control company that when they're coming to do their treatment, they send me a text, they send me an email, and they have an automated phone message as well. It drives me crazy. Not a great approach. We'll talk about a different approach here. So let's talk about the doctor welcome call. So this is one of the most proven strategies that we have tested all over the country and has a direct correlation with the show rate for new patients. So here's the process. Number one, you print out tomorrow's schedule. You highlight all the new patients. You hand that to the doctor in your morning meeting. I'm assuming you have a morning meeting. The doctor then will call or message all of tomorrow's new patients. And then in the next day's morning meeting, he'll report back, or she will report back on the results of those calls. And it basically is simple. Did you make the calls or didn't you? Yes or no? No excuses, no explanation, just did they get made? So there's a loop of accountability there. So that call or that message sounds like this. If you were making it to me, if I were your patient, then it would sound like this. Steve, this is Dr. Jones, and I'm looking forward to meeting you during your appointment, your first appointment in our office tomorrow at 3 o'clock. So I'm calling to let you know that we'll have everything set up and ready to go for you. And if there's anything that I should know before you come in that would make your visit more comfortable, give us a call. Here's our office number. Otherwise, we look forward to seeing you tomorrow at 3 o'clock. See you then. So this is a welcome call. It's not a confirmation call. It is not a reminder call. It's a welcome call from the doctor. Okay, it's very important that this comes. It differentiates your practice from almost any other healthcare environment they've been in to get this kind of a welcome call. Now, with today's technology, we have practices that are doing this in all kinds of different ways. It may be a phone call. It might be a voice text where it sends them a text message, but you hear the doctor's voice. It could be a video welcome where you have a custom video that you send with this same message that they can get by text or email. So there's a lot of different ways to do this. But the point is that it's a touch point from the doctor the day before they come in, and will have a direct correlation to the show rate of for new patients. They feel important because they've been welcomed by the doctor before they ever come in. Bottom line is they're not anonymous. They know now, the doctor knows where you live, right? So it has a positive impact on the show rate. So test it, do that for 2 or 3 weeks and see what the correlation is with your show rate for new patients. Second prevention item is insurance verification before their appointment. So this gives you an opportunity to have another touch point in terms of having financial arrangements that are clearly understood before they come in. Helps prevent the financial flu. So this is one of the great features that I appreciate about the Pearl AI pre-check module, that the AI goes out and does the insurance verification for you 48 hours in advance, gives you all the information back about that patient, what their benefits are, benefits remaining, and basically everything you need to know about their insurance, so that then in your follow-up calls before they come in different cases, then this can be a point of conversation. And the more you can figure out the financial arrangements before they come in, or the more clear that is, then the higher the show rate. Let's take all of the guesswork out of it. All right, let's talk about a second task for the doctor. In addition to the doctor welcome call, is a doctor chairside conversation when a patient accepts treatment, right? So let's say that I'm going to move ahead with a couple of crowns, whatever the treatment might be. Then this short 30-second reinforcement from the doctor helps to shore up whatever scheduling takes place after. So you would say to me, Steve, we want to do everything we can to help you get the outcome that we've discussed today. We're committed to helping you move through treatment in a timely and a comfortable way. So in order to do that, I need your help. Now, I'll pause here real quick. Those are 4 of the most powerful words I know. I need your help. I need your help. Most people cannot resist the request for help. So I love to use those anytime it's possible. I need your help. In order to help you get everything you want, we need to make sure that your appointments are set at times when you have the least likelihood of any type of a delay or interruption in your schedule, so that nothing stands in the way of doing what we've talked about today. Does that make sense? Right? So I'm just reinforcing the importance of those appointment times when they get scheduled. And then you'll say, so if you'll work with Susan, our appointment coordinator, we'll both be committed to the schedule that the 2 of you put together to make sure everything happens as planned. Fair enough? Right? So coming from the authority, it's just a short reinforcement of the importance of those appointment times, that you're committed to them and you ask them to be committed to them as well. Some additional importance on those appointment times. Now, so those are the 2 biggest doctor responsibilities: welcome call to new patients, chairside conversation when there's been agreement on the treatment that's going to be done. Let's talk about hygiene. So here's a hygiene rule. Hygiene patients are at risk, right? Because many times the impression, the feeling is, it's just a cleaning. Well, no, it's not. It's more than just a cleaning. So here would be the chairside conversation at the end of pretty much every hygiene visit. You would say to me, Steve, congratulations, you're doing a great job of taking care of the work that Dr. Jones did for you. And the best insurance policy you have to stay on track is to do your home care every day without fail, and make sure that nothing stands in the way of our regularly scheduled appointments. And then you could explain, because that helps us disrupt that bacteria from recolonizing, keeps your mouth healthy, helps us be able to clean those areas that are harder to clean at home, and keeps you healthy and on track. So then you would say, so I want you to know that when we have an appointment scheduled together, I have that time reserved especially for you. And I work hard to make sure nothing stands in the way of that. So if I could make a suggestion, do for yourself what we're doing for you here in the office. Make sure to put that appointment time on your calendar. That way, if a potential conflict comes up, you can tell them you have a prior commitment. Does that make sense? Now, there's some key psychology in this verbiage. This last part, I'll just give you a quick highlight. In psychology, in behavioral economics, this is what we call priming. So what I've done here is I'm priming them. I'm basically saying, giving them a scenario that when something comes up that might threaten or disrupt this scheduled appointment, then I'm saying to them, so you can tell them you have a prior commitment. And that prior commitment isn't just to me, it's to your health, your well-being, and your overall wellness, right? So I'm priming them to have the skills to know what to do in the eventuality that they have a potential conflict that comes up. Priming them for that eventuality. Again, placing more emphasis on that appointment time. So that's the hygiene role. We highly recommend that hygiene scheduling take place chairside. We've had a lot more success in show rates when scheduling takes place chairside. The commitment is to the hygienist, to the provider, the patient. That's a lot more successful than doing it up front. All right, scheduling hacks. So these are preventative shortcuts that will help create and maintain a more productive schedule. Hack number 1 is manage your schedule so it doesn't manage you. So what I would never say when scheduling, you would never say to me, so Steve, would you like to schedule your next appointment? Never ask me if. There's too many wrong answers to that question. So our philosophy is you want to be like the Hotel California, right? You can check out anytime you like, but you can never leave, right? You'll never leave the practice. Well, the best way to make that happen, always make sure the patient has a future scheduled appointment. The correct verbiage for that would be, Steve, which day of the week, Monday through Thursday, do you have the most control over, where you have the least likelihood of any type of an interruption in your schedule, right? So in other words, I'm setting this up, communicating, let's set this up so we can make sure it happens. So you can say which day of the week, Monday or Wednesday, whatever it is, whatever your options are that are available. I'm not asking them if, I'm asking them when, and giving them some options based on when would be the best time for their next appointment where it would not be interrupted. Next system, if you're still using appointment cards, and we recommend it, you hand the appointment card to the patient, let them fill it out, right? Let them fill it out. So what the research says is that we tend to place more importance on things that show up in our own handwriting than if it's somebody else's handwriting. So again, just a little tip of psychology. As you're working on that appointment, hand them the appointment card and a pen and say, all right, let's explore when would be the best time. Let them write it down. Next, take a look at the verbiage that you have in writing. Many times we find verbiage like in appointment cards that incentivizes cancellations. So it has verbiage that says, that has something about if you cancel within 24 hours, there's a fee, which basically then says this is not a serious commitment until 24 hours before. And that's the wrong message. We want it scheduled the right way the first time. So this is our preferred verbiage that says, please mark this important appointment on your calendar today. We look forward to seeing you at this time that has been reserved especially for you, right? So it reinforces, yeah, we take this as an important commitment, and we hope you will too. Next question for the patient is, which method of communication do you prefer? Phone, text, or email, right? We're not going to bombard them from all directions, but customize the communication by saying, Steve, as a courtesy, we may be sending you periodic messages before your appointment. Will that work for you? I don't say, we're going to send you a reminder, we're going to send a confirmation, because that implies that the commitment they're making today is not a real commitment. So this is the preferred verbiage. As a courtesy, we'll be sending you periodic messages between your appointments. Or Steve, between appointments, which way would you prefer to communicate? Phone, text, email, what works best for you? Let me show you the wrong way to do it. Now, let's talk about that communication between appointments. I've given you, these are some ones that I've saved from different medical offices that have texted me. There's a lot of examples of what not to do. Here's one. Steve, this one says, you have an appointment with Dr. Walker on this day, this time. And then they give me the option. There's 3 options here, 2 of which are unfavorable to the office. So it's like, oh, reschedule, cancel. So I got lots of options to get out of that appointment. This creates scheduling chaos. So I don't want that. I don't want to be giving easy ways for patients to mix and match. Or how about this one? Steve, please confirm your appointment, right? So that implies it wasn't firm in the first place. So if I don't respond, if I don't confirm, it must not be a commitment. How about this one? You must check in now for your appointment. It's like, really? Is this like a prison? So watch your language here. Here's some interesting data. Here's what the consumer research shows. When you use a patient's first name in the messaging, text message or email, their first name, you'll have a 57% drop in cancellations. Okay, significant impact just by using their first name. Last names haven't been found to make a difference. First names make a difference. I'll give you an example. If you're using text messages to collect for collection, for patient remainder, there's a 57% increase in collections. So significant increase in terms of response rate. So here would be an example of a suggested message. So Steve, your appointment is at 9:30 a.m. on Monday, May 26th. We're looking forward to seeing you then. And then my preferred response down below, you'll see reply Y for yes. So if you want a response from them, then you can do a user-defined response. It's a Y for yes, not a C for confirm. I'm not confirming, I'm not reminding. It's just a simple reply, yes. So I've used their first name and I give them an option to reply. So again, we're trying to reinforce that once we schedule this, right, it's a go. All right, plan ahead. This is hack number 2. So this is a concept we call excitement calls. They're not reminder calls. They're not confirmation calls. These are just random, just fun touch points with patients to keep in communication between appointments. So for example, in hygiene, when there might be a hole in the schedule and you don't have a patient, and you can call unscheduled patients. There's a lot of different things you can do. And one of the options is excitement calls. Just reach out randomly to patients to stay in touch. So if I got that message, it would be something like this. Hey, Steve, this is Jolene, your hygienist. I was thinking about you today. I'm going to see you in a couple months, but I just want to let you know that when you come in, I have some really exciting news to share with you about your health, wellness, some things that we're learning that can't wait to share with you, right? So it's just a touch point, keep them in the loop, and that then merits then you got to do your research and have new things to share with your patients every time that they come in. So for example, here might be a new one. If you just incorporated AI into your practice, this is something really cool you can share with them. Is I would say, so Steve, here's something new that I just love is we now have the technology that allows you to see what we see when we look at an x-ray. So I know in the past it's kind of looked like this. It's just kind of a big gray blob. But now this will help you see exactly what we see when we look at an x-ray, what we actually see, and it gives you some talking points. So anything that's new or different, right? They're talking points to keep the patient engaged and improve the patient relationship. Hack number 3. The unexpected will always happen. You know it. This isn't a new concept. To always keep an ASAP list to fill the schedule at the last minute. So that's previous cancellations, no-shows, patients that have had delayed treatment, overdue hygiene, unscheduled treatment. So to keep that front and center so that in the event, those exceptions, you can fill those immediately. If you're going to communicate with your ASAP list by text, here's a recommended message. Good morning, Steve. This is Diane from Happy Day Dental. Identify yourself so they know this is not an automated message. We have an appointment time that's become available tomorrow at 9 a.m. Would this work for you? So there's a lot of in terms of research, what works here. You've used the patient's first name. You've identified yourself as a real person, so they know they're texting a real person, not the office, not some automated message. This is a conversation with a person. You have not used the word cancellation. So you're not going to say, we've had a cancellation tomorrow at 9. Would that work for you? Just say, we have an appointment time that's become available tomorrow at 9 a.m. and then ask for a response. So what we know about text messages is that 97% of text messages get a response within 3 minutes. So as long as you've got their permission to do that, then it makes it a lot easier. Okay, so Jerica says our office uses Vine Trellis for appointment reminders. Replying C is the only response Vine recognizes to link the appointment confirmation of the appointment book for Dentrix. With that said, what do you suggest the verbiage be used for that for appointment reminders? So, and they may be the exception. Most all the technology companies I've checked with, they do have user-defined responses. So if that is not the case, if C is the only choice you have, then I would say reply C for yes. So again, you'll see this in just a minute, but verbiage matters. So if that's the only choice you have, Jerica, then you can do C for yes. I know that. And so if that's the only choice, then you can, if they allow you to at least customize some of it, that would be my preference. Hack number 4, common sense, block schedule, right? So the best way to stay in control of your schedule, pre-block for the types of appointments you want. And then hack number 5, give patients options, right? I never ask them again if they want to schedule. I give them a choice of what we have available to schedule. So what you would say to me is, all right, so Steve, for your next restorative appointment with Dr. Jones, would next week, would Wednesday or Thursday work better for you, right? You're going to give me the option based on what you have available. So you never say to the patient, what works for you? When would you like to come back? You're going to say, would a Wednesday or Thursday work better for you? Wednesday, great. Morning or afternoon? Again, you're giving me choices based on what you've pre-blocked for that type of treatment, right? Always give me a choice. Don't give me a chance. When would you like to come back? Would you like to come back? So you manage it with the block schedule, give me choices based on what you pre-blocked. And then hack number 6 is the 24-hour rule, which is you don't violate the blocks unless it's 24 hours in advance. So then within 24 hours, it's like we're pulling out the ASAP list and we're going to put in those blocks whatever we can schedule so that we have a productive schedule. So preserve the blocks up until 24 hours, and then it's go to work on your ASAP list to fill the schedule, backfill it with whatever you can. Okay, this one should be a giveaway by now. So if you're going to take this quick poll, which words should you never use verbally or in writing? The word confirm, remind, cancel, or all of the above? It's all of the above, okay? So I'm going to challenge you to take this back to your whole team to go for an entire week without using any of those words. You can't use confirm, remind, or cancel. You can't use those with each other, and you can't use those with patients. So then you might ask, well, Steve, should we be confirming our patients? Okay, so we're not going to use the word confirm or remind because it implies it wasn't firm or that they didn't remember. So if you are sending me a message, it would be, again, Steve, your appointment's at 9:30 on Monday. We'll see you then. Reply Y for yes. Or Jerica, in your case, reply C for yes. Right? But I'm not going to confirm. It's not we're reminding you about your appointment on Monday. No, because it implies that they're not responsible enough to remember on their own. Right? So no confirm, no remind, no talk of cancellations. Again, little things add up to be the big things. Hack number 8, the most powerful words for patient commitment are the words will you. So I'm going to be asking for a commitment. So for example, you would say, so if you're calling, you would say, Steve, this is Jerica from Jerica, whatever your office name is. This is Jerica from ABC Dental. I'm calling about your reserved appointment with Dr. Jones tomorrow at 3 o'clock. Now, I wanted you to know that we'll have everything ready for your appointment. We're looking forward to seeing you tomorrow at 3 o'clock. Will you be here? Right? So it's just that simple, again, upbeat. Will you be here? So again, I haven't said I'm calling to confirm. I'm not calling to say I'm reminding you. I'm calling about your reserved appointment with Dr. Jones tomorrow. We'll have everything set up and ready to go. Look forward to seeing you. Will you be here? Right? That's, again, there's so many applications to those 2 words, but the challenge here is start asking for commitments. Don't make requests. Start asking for commitments to get a yes from your patients so that they're committed to come. Hack number 9, prevent the financial flu. Right? So the financial flu, again, is when patients get sick because they don't want to pay on the day of service. So the secret here, and this is a big cancellation prevention, separate the payment from the day of service. So the bigger the case, the bigger the payment, separate it from the date of service. So payment isn't when they show up for that large procedure. So you can pick a dollar amount. We have a lot of practices that say, hey, if it's over $500, then we're going to separate payment from the date of service. So in hygiene, you can probably take a date of service. And we have practices all over the country that kept using their COVID financial protocol. So here's what happened is during COVID, because we were trying to minimize, the contact with different people in the office, then many practices got in the habit of calling in advance and making financial arrangements with the patient before they came in so they wouldn't have to stop by the front desk to make payment. We have many practices that have continued that same process, especially for hygiene. So patients are paying in advance for their hygiene appointment, not on the day of service. Well, you can use that same protocol for restorative treatment that you can separate. If it's over $500, you can separate and you make the financial arrangements. You separate the date of the payment is different than the date of service. So you make the financial arrangements and you would say to me, so Steve, you're going to reserve your appointment time. It'll be $250 today that we'll go ahead and run, which will 100% of that goes towards your treatment. And then we'll run the balance on the Monday of the week when you're coming in. So that way, you don't have to worry about making payment when you come in. All you have to worry about is getting here, and we'll take great care of you, right? It's just how we do things. So again, the overall principle, separate payment from the date of service for your bigger cases. Hack number 10, peace of mind, right? So this is giving your patients the highest level of peace of mind for their health and their long-term wellness. So this is one that we've tested across the country. And there's a huge demand for this today. This is what's called the uncertainty index. This is a consumer index that's been tracked for many, many years in terms of how much uncertainty is there in the economy. We're at an all-time high today, all-time high. So what consumers are looking for now is certainty in an uncertain world. So this is one way you can do this. So dental warranty is a protection plan that protects all types of restorative treatment. So anything that goes in the mouth, then their protection plan will cover that work for up to 6 years, no fault, meaning if it has to be repaired or replaced, then it can be repaired or replaced up to the full amount that they originally paid for that treatment. The office gets reimbursed for doing the work, and the patient gets the repair or the replacement at no extra charge for over 6 years. Now, with that comes the responsibility on the patient's part to keep up with their regularly scheduled hygiene appointments. So this becomes an additional incentive to keep your appointment, right? To keep your appointment so that we can keep your protection plan in place. So if you'd like a demo of how this works, you can scan that and the team at Dental Warranty will walk you through how providing more protection, more peace of mind for your patients can increase your show rate and keep a more consistent schedule because they have now one more reason to show up. All right, quick question. Which day of the week is the most dreaded cancellation day in the office? Sunday night, Monday morning, the last day of the work week, or every day? Now, Sunday night, those of you that work in the front office, you're home sick, knowing what you have to face on Monday morning because of all the overnight, over the weekend changes and cancellations and patient messages. So we've done this to ourselves. We've made Monday a disaster. It is the most challenging day of the week because of everything that's happened over the weekend. So to minimize that, could I suggest the following change? And there's a couple of things I would suggest. Change the after hours message. So change your after hours message because typically it's like, hey, we're not here. Leave us a message. and then it's like, hey, Steve Anderson here. I'm not going to be able to make it in for my Monday appointment at 8 a.m. And then, it's time stamped Sunday midnight, right? They called when you knew they wouldn't. They knew you wouldn't be there. So change that after hours message to say, thanks for calling after hours and like to reserve an appointment. Here, leave your name and phone number. If you have a dental emergency, call 911. Or if you have a conflict with your scheduled appointment, either please call back during business hours, or please call the doctor, or please call this number. Our voicemail system's not monitored for scheduling changes, right? So again, you leave a very clear path for if they're calling to change, they're going to have a different path, but it's not just leave a message. So we got to pick up the pieces and figure it out. There is some great technology that's coming out now in terms of AI-driven after hours, responding to after hours calls. So I'll give you a little sneak peek of coming attractions. We're actually training AI how to handle requests for cancellations after hours. So that's coming because there's a proper way to handle that. In the meantime, for your after hours message, change it with specific instructions. Illness remedies. So these are people who call and say, I can't come in, I'm not sick, or I am sick. It's more challenging today to, question that. So the prescription here is one, reappoint right now. So if they're well enough to call, they're well enough to reappoint. So go out 2 weeks and reschedule that appointment, which then demands that what we call your T3. So your T3 is what is your schedule today, tomorrow, and 2 weeks out, that you keep that view constantly in view so that you know where the options are to be able to place people. If they call to cancel, so we're now into first aid, right? First aid, what do you do in the heat of the moment? The first thing, typically when people call and they go, oh, I'm so sorry, I can't come in, they're very apologetic. And so the trap is that we want to apologize. We want to say, oh, it's okay. Well, no, it's not, right? You want to respond, not react. And so the recommended response is when they say, I can't make it in, is to pause, say, oh, would you mind holding for just a moment while I get your records? Put them on hold, pull up their chart, see what they're scheduled for, see in all the notes why they scheduled that particular treatment. Okay, so you've got context. And then you can get back on and say, Steve, thanks for holding. Now I'm reviewing your records. We have you reserved tomorrow at 2 p.m. with Dr. Jones for the prep work on those 8 veneers, which I know you said you wanted to have done before your high school reunion that's coming up. If you got that context, right? So then it's the ask, Steve, what can we do to keep this appointment? I know this is important to you. What can we do to keep this appointment as originally scheduled? I'm just going to ask in a nice way. I'm going to ask one more time. What can we do to keep this as originally scheduled so we can help keep you on track? Now, in some of the cases, what they found, they may say, well, if it's that big of a deal, I'll cancel my golf game or I'll cancel this lunch. Now, if it is unavoidable, if there's a meeting that's been called and they have to be there, then we'll take the next step. You would say, so Steve, let me see what I can do to find something that will work for all of us. Now, which day and time do you have the most control over when you have the least likelihood of any kind of an interruption in your schedule so we can keep this from happening again, right? So again, the messaging consistently is, in our practice, the culture is when we make appointments, we stick to the commitment. Okay, so let's talk about frequent offenders. So these are the ones that just like continually cancel and no show. They become infamous in your practice. So if this has now gone on, 3 or 4 times, you're not going to dismiss them from the practice. I get to ask that, if they don't show up, we're going to dismiss them from the practice. Well, give them a chance. Sometimes these are people that have a hectic schedule. Maybe they're organizationally challenged. Maybe they, whatever it is. So you would say this for starters, you say, Steve, I need your help. There's those 4 words again. For some reason, we haven't been able to make these appointments work like we need to. I just look back and we've rescheduled this appointment at least 5 times. So what would you suggest we do to get this back on track, right? Go to them and say, what would help you so that we can help you get back on track to make this happen, right? We're helping them. So, then on your VIP, this is your VIP list. This is part of your ASAP list. So these are the ones that just have a problem showing up. Hectic schedule, organizationally challenged, short-term memory problems, whatever it is. And so what I would say to this patient is, so Steve, why don't we do this? When we have an appointment that becomes available short notice, like same day or next day, may I have your permission to shoot you a text, give you a call, whatever their preferred method of communication is, to see if you would be available to come in, same day or next day. Would that help you? For some people, that's what they prefer. Just like, you let me know when you got an opening, so I don't have to plan that far ahead. And if I'm available, I'll come in. So sometimes frequent offenders can be your best friend on your ASAP list to get them in on short notice. All right, so that is a lot. Those are a lot of tips in terms of how to continually build and manage a schedule that, that happens as planned. That's always our goal. It never happens exactly as planned, but this will up the score and make it easier. So here's some suggested action items. This is a team sport. Everybody needs to be involved. So take it to the team. Take the hack sheet that I shared. If you came on later, you can scan this for the hack sheet. So take that to your team. Go through what everybody's role is in scheduling and cancellation. Track your success. Highlight your save of the day at your morning opportunity meeting. So that you're making this a fun thing to build and maintain. a consistent, predictable schedule. So this is an example of many of what it takes to be able to run consistently with your team. Everybody has to be trained. The best teams that we work with at Total Patient Service and in the Crown Council, they train on a regular basis, just like a sports team. They're training on a regular basis. So here are some suggestions for ingredients for keeping your team trained in areas like we've talked about today. Number one, what's your source for content? So where do you turn for proper training that's been proven to work? So you got to have a source. So for example, at Total Patient Service, we have an entire virtual coaching platform that'll help you keep your team trained. Number two, what's your cadence? How often do you do it? So the best teams don't train just because they have a problem. They're ongoing on a regular basis, even every week. They are doing some type of training to keep everyone trained and to increase their skills. Number three, who's going to coach it in? Right? In other words, who's responsible for keeping the team trained and driving the implementation? It's a coach's job to make sure the team wins. So whether that's a mentor, could be someone that's highly qualified on the team, or it could be a professional coach. We have a lot of those at Total Patient Service, but somebody's got to be accountable for coaching it in to help the team win. And then finally, how are you going to measure effectiveness and results? So this is an example of a scoreboard. There's a lot of digital ways to do this. I prefer this because it's updated daily. It's in the break room. It's live. And the team can talk about it every day, but it measures more than just production and collections. It's measuring, for example, how many cancellations did we have today, right? We want to keep that number to a minimum. So measure your success. So those are 4 ingredients. Just as a quick update from our team at Total Patient Service, there's 3 ways the teams interact with us. Virtual coaching, where they work on a virtual coaching platform, distance with a live coach that trains in proven systems to hear yes more often from your patients. Events. So we have team training events all over the country on a regular basis where teams come together to learn together and train together. And then we have in-office coaching where the coach actually comes to the practice and works with the team. So that's how we interact with teams on an ongoing basis. So for a guided tour of how those work to keep your team trained on a regular basis, you can scan this QR code to schedule a tour of how you can keep your team trained to be a top performing team. It takes training, it takes practice. And when you have a system built in, it makes it easier to perform at the highest level. So those are a couple of tips and tricks. I know, Sheela, you also have a quick update from Pearl, as well as for those that would like CE for today, there is an hour's worth of CE for those who would like it. So we'll have that coming up here shortly. And Amanda, yes, we do work with practices in Canada. We love Canada. We don't want you to be a state of the United States. We love Canada for what Canada is. So, yeah, yes, Amanda, we work with practices in Canada. All right, Sheela, it's all yours.
Excellent. Well, thank you so much, Steve, for all of this information. We are going to be hanging out for another few minutes to answer any questions. So if you have something you'd like to bring up, please feel free to put that in the chat. This is your CE code, so feel free to scan that. And a couple other kind of quick housekeeping tips. This video, this recording, this webinar will be recorded and it will be sent to you. So that'll be nice. There's also additional webinars at hellopearl.com that are on demand, and some of Steve's previous webinars are there as well. So we invite you to check back so you can hear Steve again. And I would also like to invite you, Steve, if you don't mind if I share my screen here for just a minute.
Yes. Just real quick, if you scan that for CE credit, all you have to do is just fill out the form. It'll ask you for information, and then you'll get an email with instructions on how to retrieve your certificate. So it's really easy. If you want CE, you need to register for it today. Um, can't do it a month from now. Got to do it today. There's a timing issue here. So hopefully that helps. Okay, I will unshare my screen, Sheila. It's all yours.
Perfect. And we'll pop that back up in just a moment.
Yes.
But, you saw some of the images that Steve showed earlier, and in addition to everything that you learned today with preventing these cancellations, so much information today, just those small tips and tricks about how we can change our verbiage, and things we haven't thought of before, right? It's interesting to hear patients' perceptions, and I learned a lot today on this call. But having these images chairside, once the patient arrives, is really also a game changer for enhancing that case acceptance. Steve was also saying the ability for your patients to see what you're seeing as a clinician really allows them to accept dentistry earlier and more often, less invasive, less expensive. They love you that way, and they come back more often. So if you would like to schedule a demo that shows your patient's images in color in real time and also a historical look back. Or if you're interested in Pearl's PreCheck insurance verification system that also looks into EOBs and to specific histories, we are excited to have you scan this QR code. You will also be able to get a 30-day trial, free month. So we look forward to really just meeting with your team, see how Pearl can best assist with you. I also want to make sure that we go back to that CE credit in just a moment, just in case everybody wants to scan that one more time. And I think there may be a few questions here as
There
well.
are. Okay. One of the questions, Sheila, is how do I scan if I'm on mobile? She's watching this on her cell phone.
Yes, I think probably we'll take a picture and then also I can just a quick screenshot and you can get that in. But I can also put the link inside of the Q&A for you.
Ooh, that'd be great. Yeah, you do that.
Perfect.
Okay, I got a couple of questions. I'll switch back to the CE code if that's all right. So there's that. All right, a couple of questions for patients. This is from Bridget. Patients who want to reschedule through text, you can't pause and say, oh. What's the suggested reply text? So just skip ahead to the next deal. So Bridget, if you had texted in, I would again go look up their record, look at what they're scheduled for, the whole deal, and say, Bridget, thanks for reaching out. So you're scheduled tomorrow at 2 o'clock for the prep work we discussed. What can we do to keep this as originally scheduled so that we can keep you on track? Again, it's a conversation, so I'm going to use the same verbal skills on text as I am on the phone. And if they just, if they say, look, I had a meeting that's come up and it's my job, it's mandatory, I have to be there, then we're going to go to the next step to say, okay, let me see what I can do to get this rescheduled. Which day of the week do you have the most control over so, we can keep this from happening again, right? So same thing. So just skip the O and skip the that and but again, same verbal skills, text messaging as you do verbally would help. Okay, I think that takes care of the questions, Sheila. Hey,
Okay.
thanks for hosting today, Sheila. It was great to be with you as always. And thanks for everybody for watching. This is an ongoing effort, never ending to, keep the entire team trained on how to schedule appointments, how to keep them in place. So we're here as a resource to help. Our big deal, Sheila, is we think dentistry ought to be the #1 patient service segment in healthcare. We see more of America than anybody and Canada than anybody else in healthcare. We ought to do it better than anybody else. I think we can do it. And this is just one of many, many things you can do to provide great patient service and to hear yes more often from your patients. So let's make it happen.
Excellent. Thank you, Steve, so much for spending time with us today. And we look forward to seeing you and all of you that have joined us today in the near future. Have a
Thanks,
great
everybody.
day. Bye.